Joining us now is Dr. Sacha Bhatia, who is Choosing Wisely Canada's measurement lead and a cardiologist at Women's College Hospital in Toronto. Sacha, what is the goal of Choosing Wisely Canada?
Jill, the goal of Choosing Wisely Canada is really to improve the quality of patient care that we provide across the country, mainly by reducing the potential harm that can be had through unnecessary testing, or what we call low-value care. Low-value care is really care, either tests, treatments, medications given to people for whom the benefits aren't really noted by evidence, or where the harm of the potential harms outweigh the benefits of those tests.
So is it that evidence that allows you to determine what is unnecessary and what is necessary when it comes to medical treatments and tests?
Yeah, I mean, it's grounded in sort of the literature and research that's been done, and also expert consensus. So the medical societies across the country develop these lists, working together of top 5 test treatments or procedures that their medical society deems as low value.
Why are doctors asking for unnecessary tests and medicines?
You know, it's a great question, Jill. I think some of it is just kind of the way that we practice and the evolution of care. So I can remember when I was a resident, as a cardiology resident, we used to do stress testing, almost routinely in patients just to check their heart status. And we know now through research that you don't need to do that anymore. And in fact, it doesn't really add any value to patient care, but might actually lead to further testing that might cause harm. But it takes time, for practices to change. And I think that's something that, I think Choosing Wisely has sort of focused on, that practice change. And I think the other thing is there's kind of been a paradigm shift in medicine where for a long time we often thought more was better. So more tests meant you were being more thorough. And I think as we're starting to understand the research a bit more, we're starting to realize that in fact we kind of have to personalize the care to individual patients. And sometimes, more isn't always better.
How is it that some of these tests and medicines are harmful to patients?
So it's a great question. So, oftentimes we can do routine testing that leads to something called a false positive. So a lot of tests aren't 100% accurate. They have to be interpreted within the context of the patient's clinical condition. And a false positive that can happen can lead to other more invasive tests, all of which may have the risk of causing a side effect. And so, if you think that the test itself isn't necessarily going to lead to more information that's going to help the treatment of a patient, you're exposing that patient potentially to risk that would be unneeded.
Thanks for your time today, Sacha. I appreciate it.
Thanks so much.